Our studio guest is no stranger, actually, to the studio. Russell Singleton is a physician assistant at Tripp Family Medicine right here in Twin Falls, and somewhat alternates with Dr. Jonathan Tripp on the program. Dr. Tripp, of course, ceding control of the microphone today to to Russell. Russell's actually talking about some dietary issues, right?
Yeah, I think we have some really interesting things to talk about today, Bill, and I think they're things that will probably interest the majority of our listenership because the majority of those listeners probably have some experience with high cholesterol or
Mm-hmm.
treating high cholesterol, and there have been some new recommendations, some new guidelines that actually turn old ways of thinking on their head. And so I thought we'd talk a little bit about that today, and maybe talk to some callers if there's an interest in that particular area.
I know the first time I was ever prescribed was Lipitor, and I had at the time, I think my cholesterol was only maybe 160 or 70, but they gave me this 40 milligram pill, which knocked it down to 74. Now, later, it was changed to something that was lighter. But I was told at the time that they wanted to try that because they said it's also possibly would help prevent strokes. That was 6 or 7 years ago, and I've since been on a milder form ever since then.
You know, that is exactly where we're headed with today's discussion. What is heart disease? How is cholesterol related to heart disease? How do we treat heart disease? And you made mention of Lipitor, which is a statin drug. We're going to talk, if there's time, hopefully talk all about statin drugs, why we use them, why they work, and actually additional guidelines that came out within the last year or two about how we prescribe statins. Because you mentioned something interesting. You mentioned your LDL level, I'm assuming, or was that your total cholesterol level? Do you remember that 160?
Yeah, it was total, I think. Yeah.
Well, previously, under old guidelines that we referred to as ATP3, we treated labs more than anything. If a patient had an LDL level of 160 or 190, then we chose to treat them down to a certain level in order to mitigate the risk for heart disease. We would want them down to 130 or down to 100 or down to 70. Well, according to the American College of Cardiology, that is changing, or it should be changing. And actually, we don't focus on goals as much anymore. We try and assess risk, first of all, and determine whether you're a low risk, medium risk, or high risk, and then assign you a statin if indicated at either a low dose, medium dose, or high dose, and then basically send you on your way. Those are the new guidelines, and hopefully we get to talk a little bit more about that, why that may or may not be a good thing, and how that affects individual listeners and individual patients.
I was going to say, I had a friend I worked with. He had a number that was in excess of 300 when he got tested. So I was told that mine was actually pretty good compared to some of what they see walk through an office.
Oh, absolutely. If it was a total number of less than 200, I would have said there may or may not be anything to treat here. Of course, we need to look at other risk factors, family history.
That was my family history.
Yeah, if you have a first degree relative, meaning a mother, father, or a sibling, and sometimes maybe even a child, that suffered a heart attack at a young age, around 50, 55 for men, 60, 65 for women, that is a significant risk for you. Smoking is another risk. We can talk about sedentary lifestyles, hypertension, blood sugars that are too high, what we might call insulin resistance or prediabetes, and then diabetes too. We've talked about that in the past, and in my opinion, and in the opinion of many experts, to have diabetes is equivalent to having heart disease, and so we treat the two the same because they play off of one another, and the whole process is accelerated.
And of course, diabetes has such a wide impact. With your eyesight, with your heart, with your extremities. These are all things that we sometimes miss. That a particular illness is so interconnected to everything else in our bodies.
Absolutely, and diabetes does, in fact, cause uh, changes to liver function, to eyesight. In fact, diabetic retinopathy is the leading cause of blindness in the United States. Completely preventable, or at least largely preventable, if we diagnose and manage diabetes early. And as dramatic as those consequences are, I don't think those are really the major consequences. I think cardiac events, heart attacks, and maybe even strokes are the most significant complications of diabetes. what is more likely to kill you if you have diabetes, a heart attack? And so coming back to these new recommendations for cholesterol consumption and statin dosing, I think is really relevant to folks out there listening.
We want to point out, joining us in studio, Russell Singleton. He's a physician assistant at Tripp Family Medicine here in Twin Falls, and we'll be taking a break in about a minute, but also we'd be interested in some of your telephone calls for the remainder of the half hour as well, following the break that's coming up in just a couple of minutes. And you're going to talk a little bit about fat consumption too, as
Oh,
well.
yeah, I think we could just get that going here in the next minute. But for probably the last generation, the question has been cholesterol. Should it be something we eat or not eat? Should we manage it or not? Look at the egg, for example. Is it good? Is it bad? Should we eat it? Should we not? Well, that has been completely reversed. The newest guidelines, or at least the advisory committee for the ADA, has said that, quote, cholesterol is not considered a nutrient of concern for overconsumption. And so that is headline news. Absolutely.
We've got more coming up in just a couple of minutes. We do want to mention again, we're expecting some of your telephone calls. If you're so inclined today, 736-0300. In the meantime, some messages ahead, but more coming up with Russell Singleton in just a couple of minutes. Russell Singleton is joining us in studio today from Tripp Family Medicine right here in Twin Falls, Idaho. In fact, located on Fillmore Street directly across from the main post office. Of course, you're listening to Top Story as well with Bill Colley on News Radio 1310 KLIX and newsradio1310.com. We should point out that Better Health, we do this every Wednesday between 8:30 and 9 o'clock. We had a call off air yesterday, Russell, from a woman who is a patient and a big fan of your office. And she's listening. She's going to try to listen online when she can. She's got an appointment in Boise this morning, so she may be listening in her car. So we just want to say hi to Charlotte because she was excited to find out that this was on every Wednesday morning.
Absolutely. Thank you, Charlotte.
We want to also point out we were talking a little bit about cholesterol levels in the previous segment of the program. It's 8:44:51. And we just, at the very end of that segment, we veered off and talked a little bit about fat consumption. And during the break, you were telling me that fat has really been a villain in a lot of our recommendations for 30 years, but maybe we need to think a little differently about that now, too.
I think that is absolutely correct. And we see that with this new statement from the advisory committee, which is tasked to develop what's called the Dietary Guidelines for Americans produced by the ADA. And again, they have said, quote, cholesterol is not considered a nutrient of concern for overconsumption, which is a huge reversal of what we have thought for decades. And it's important to understand what cholesterol is. First of all, it's a waxy, fatty substance that actually plays a critical role in the body. It is a component of cell structures. It protects nerves. It is the basis of steroid hormones like testosterone and estrogen. It helps to form bile acids that digest and absorb other fats, vitamin D, the list just goes on. We need cholesterol. The question has been, does dietary cholesterol have an effect on blood cholesterol? And it turns out after decades, we just don't have that evidence. We can't continue to say that. And there is another interesting study published last year in the Annals of Internal Medicine that challenged the idea that saturated fat consumption is a significant driver of heart disease, because there's two main theories behind the development of heart disease. There's this LDL theory that having high levels of LDL cholesterol is a contributor to developing atherosclerosis, which is plaque buildup within the arteries, hardening of the arteries. And then there's the inflammation theory. But the question has been, does cholesterol affect this, but then does fat consumption, does saturated fat consumption affect this? And the American Heart Association hasn't yet changed their position, along with many other major medical organizations, but the evidence is now starting to surface that even saturated fat consumption, and certainly saturated fat from dairy, doesn't significantly contribute to not LDL levels per se, but heart disease.
We have a caller looking to join us during this segment of the program. Just to let you know, you can reach us on Better Health this morning on KLIX by dialing 736-0300. And you're up next. You're on the air.
I've actually heard recently about the study you're talking about, or the fact that they're dropping the demonization of cholesterol. I've also heard something about salt. Is this something that is going to change our daily intake of salt? Because I heard recently the same thing about salt, that they demonize salt, and really it's not an issue unless you have issues with salt. And how often does this kind of stuff happen, where they're just telling us something willy nilly, and the reality is actually different than what they're telling us?
There are a couple of really great questions there, and I appreciate both of those. First of all, to address the salt issue, the latest guidelines and the latest research still does support limiting salt intake. I'm only recommending a low sodium diet for those that actually have hypertension, that have high blood pressure. I recommend it to everyone upon initial diagnosis, because sometimes we can actually control hypertension without medication if they simply will stop smoking, become more active, lose a little bit of weight, and reduce sodium consumption. But sometimes we get to a point where they're on 2 or 3 medicines, maybe 4 medicines, we're not controlling it, and we really need to crack down on sodium consumption. So I will be interested to see whether or not that changes in the future. I think it's totally possible. And that leads us to your second question. Why does it seem like science and medicine flip-flops so often? And are they really recommending things willy-nilly? And to those that are outside of medicine and outside of science in general, it really does seem like that. And it is incredibly frustrating. I brought up the egg recently. Do we eat it? Do we not? Is butter better than margarine? Vice versa. Why are we always changing? And actually, I find that encouraging. I think that is the beauty of science, that as we gain new knowledge and new information, we edge out old ways of thinking and we adapt, we evolve, we continue to get better and to recommend things that falls in line with that new evidence. So will it change in the future? Maybe, probably. And when it does, we'll do our best to adapt. So I would try and look at that not as something suspicious, but evidence that there is continual study and thought into these important topics.
And we could point out too, as well, I guess, that sometimes these studies are done, and the results are, even though later on we may say, well, okay, we have a different result now, a different result from some of the research, but you were on the right path even before you got there with the previous studies.
And it takes more than one study to really change our mind and to change our practice. But the media doesn't really understand that, or they don't care, because as soon as there's a sensational finding, they will report on this because fear sells, gloom and doom sells. They're in the business of selling ad space, and so they want to sensationalize these findings that really may be quite insignificant. It takes not only a good double-blind, randomized, controlled trial to show causation and to change our thinking, but it takes several of those randomized controlled trials. Once a scientist finds something, it then has to be reproduced by his colleagues many times, and then we put all these studies together and we perform what's called either a systematic review or a meta-analysis, which is a study of all the available studies, and then we start to change the way we think. So really, I think that term willy-nilly is interesting, because there's certainly no willy-nilly about it, and it takes a healthy body of data to change, but there will always be conflicting data, and that's because study types vary, the variables that they control, the population that they looked at are all different. So it really does take years to see a trend, but once that trend is seen, we do our best to keep up with it.
Our guest is joining us this morning on Better Health with Tripp Family Medicine. His name is Russell Singleton, physician assistant, and he'll be here until 9 o'clock this morning. It's 9 minutes away from 9:52. Bill Colley with you as well on Top Story on News Radio 1310 KLIX and newsradio1310.com. You know, we should point out there too, when someone says a couple of glasses of wine might be good for you a day, that could be true, but 20 glasses of wine would not. And when someone says, salt may not be that harmful, but we've got to realize if you're buying a canned good, it's already loaded with a lot of salt. You don't have to really add anything to it. So a lot of these things, A coffee, caffeine, I'm told now, is probably good for me if I have a couple of cups, but if I have a full pot, maybe not so much.
Yeah, I think moderation in all things is a healthy way to live life. And to address the other thing you brought up, we've always recommended a diet rich in fresh fruits and vegetables, lean meats, fish, and exercising while avoiding things like smoking, excess alcohol consumption. But even that, speaking of flip flops or speaking of evolution and scientific understanding, that the alcohol heart disease link has been not all but reversed. And I wouldn't recommend anyone drink alcohol to further their heart health. But you're right. If there ever was a protective factor of drinking certain types of red wine, there was a very fine line between what was healthy and then entering that danger zone once more and actually causing damage to yourself.
A purple cabbage, wouldn't that have the same effect? Because we're looking at that. I read one time where it really comes down to red or purple foods. And so if you have radishes or a purple cabbage or something like that, you're not going to have any alcohol effects, but you're still going to get the resveratrol. Is that it? That's the ingredient?
Yeah, supposedly. And I've always wondered that too. If there's something in red wine that is so healthy, couldn't you get the same nutrient from the grape and get the fiber along with it, bypass the effects of the alcohol? So I think that's a good point.
Versus an hour-long walk every day or 2 glasses of wine, which one's better for your health?
That's a great question. And before I comment on that, I would want to say that I try and look at available evidence before I answer a question like that. I want a patient to understand where my answer is coming from. I never want to give a patient my opinion because honestly, my opinion isn't worth anything. What I'm trying to do is relay best evidence. And I'm trying to digest, interpret that evidence, and make it available so a patient can make an informed decision. Mm-hmm. So to be honest, I don't know that I can answer that question because I don't know that it's been studied. I don't know that they've had a well-designed randomized controlled trial comparing those of a similar risk profile that walk an hour a day versus those that have a glass of wine or two a day and determine the outcomes. I don't know. I hate to answer that because, again, it hasn't been studied.
My neighbor told me the other day she walks her dog 6 times a day and she's lost 70 pounds. So I think for her, the walking would be better.
Yeah, amen to that.
It's 8:54. And by the way, our telephone number, if you'd like to reach Russell while he's in studio with us, 736-0300, 736-0300. We should also point out the contact information for Tripp Family Medicine.
Absolutely. Give us a call, 933-4400. We try and save appointments every day for same day. And in fact, we are getting so busy, yet we want to preserve that access to your provider that we are hiring a couple of new providers, a nurse practitioner, Crystal King, and then a physician assistant like myself who's on his way out from Texas. So we hope to keep growing along with the demand because our goal is to provide excellent healthcare and to really be a viable alternative in this area.
We should point out anybody moving here from Texas, it's exactly the same. It's just a little smaller. So we have another caller with us. It's 8:55, and you're on the air with Russell Singleton.
Yeah, good morning, Bill. What were your side effects with your statins? I've heard various horror stories about them, and I certainly didn't go to medical school, but I am surprised with that low a number that anybody would treat you with statins. I know family history, you mentioned that, but what were your side effects? And I'll listen off the air. Thanks.
I don't think I had any, but later on a doctor just prescribed something a bit milder for me. I think in the beginning, when we got it down so low, that was almost a shock, and so I was switched to some other, which will happen sometimes, right, Russell?
Yeah, and I think that is another great question, and I really appreciate the caller bringing that up because there are a lot of concerns about medication side effects in general, but also statin side effects. And going back to published data, statins are actually very well tolerated overall. Now, we've always been concerned of a very serious but rare side effect of liver and muscle damage. That has been so few and far between, actually, that these new guidelines from the American College of Cardiology actually say that we shouldn't even be monitoring liver function anymore because statins are so safe. But before I go on, many patients do complain of muscle aches and pains.
I
And
never had those.
so I think that's probably what the caller is getting at. There are a fair amount of people who, not because of serious side effects, but just because of these muscle aches and pains, don't tolerate statins. But then again, let's look at published research. The majority of those folks that are uh, tr- re-prescribed or retried on statins actually tolerate them just fine. And we've got a lot of other tips and tricks in the office, Dr. Tripp and I, to make that more tolerable. Statins not only improve LDL cholesterol, but for whatever reason, they save lives. And we don't understand fully how statins do that outside of LDL reduction. But statins are one of the greatest medical innovations in the last 10, 20 years. They're absolutely not for everyone. And perhaps you should or should not have been prescribed that. But if it comes down to choosing between whether or not I should take a statin because of potential side effects, man, we're going to work towards getting you on that because it will very possibly save your life.
Next week, we'll either see you or the doctor. We're just, we're flipping a coin, right?
No, Dr. Tripp's going to be here. He's going to talk about harvest and what we're really eating.
Oh, it's pumpkin pie time of year. That's
pumpkin
true.
Spice everything.
Yes.
Thank goodness. It's finally here.
Best time of year, I think. I have a birthday coming up in October, and it was always the best time of year to eat and sit down and just celebrate a birthday. 8:58 coming up on 8:59. Coming up, I think, after the newscast, and I say I think because I'm not sure who's in the rotation. I believe we're going to be talking a little bit about city government. We may have a member of the Twin Falls City Council joining us. As I say, my schedule is not in front of me, but you'll have to trust us on this one. We want to thank Russell Singleton for joining us as well this morning from Tripp Family Medicine. News is next from Fox.